Hey everybody, Dr. Barron here with the virtualheadacheспecialist.com. I just want to drop a quick note on fibromyalgia. We see this very commonly in many of our headache and migraine patients. A lot of times patients are hesitant to mention this, and the reason is because unfortunately there is still a lot of stigma out there with some physicians that tell them the pain's not real, it's in your head. These physicians should be ignored because this is an old way of thinking about fibromyalgia. There are PET scan studies that show that the areas in the brain that are involved in pain processing are overactive metabolically, so they are in overdrive in fibromyalgia. And so fibromyalgia, chronic migraine, IBS, irritable bowel syndrome, these things often cluster together, and they are all driven by an overactive neurologic system. And so patients with these symptoms often are more sensitive to medications. Side effect wise, they are more sensitive to stimuli, whether that is touch in the body, pain, light, sound, smell. You know, the nervous system essentially is in overdrive. It's turned up high volume, so the treatment becomes trying to find something to turn that volume back down to a lower level where you're not getting so much pain and other symptoms. And we do that with a variety of ways. Various treatments are used for that. Gabapentin, Cymbalta, Lyrica, these things are often used for fibromyalgia first line, assuming a therapeutic dose. A lot of people don't go to the right dose of these medicines, but there's a number of things that we use to try to hit all of these at the same time, chronic migraine and fibro. And so anyway, just want to highlight that because I still see that a lot. Unfortunately, patients come in and they mention their doctor said fibromyalgia is not real, but it's absolutely real. So, you know, these physicians are just not up to date on science, unfortunately. All right, guys, have a good one.